Good afternoon, dear patients. Today we will discuss a clinical case presented in the picture. A student came to us who had already visited the dermatologist at his university clinic. There, accordingly, he was diagnosed with a skin allergy without any tests. He really did have itching. There were red spots both on his abdomen and on his back. And in addition, there was one large spot on his back. It was surrounded by scales and relatively smooth in the center, but red, as you can see in the picture. Accordingly, in general, with such a presentation, it was impossible to rule out a combination of two diseases. First of all, the large spot. It looked like a fungal infection, so a scraping for fungus was taken. That was the first thing. Secondly, blood was taken to test for allergies, including indicators such as a complete blood count, immunoglobulins, circulating immune complexes, and eosinophilic cationic protein. Since the doctors had diagnosed an allergy, but tests confirming the presence or absence of an allergy had not been performed. And tests for syphilis and HIV were also taken, because with widespread rashes, especially reddish spots that are barely noticeable, as you can see in the picture, it is quite difficult. Let's just say it's not possible to rule out diseases like syphilis, for example. Accordingly, the patient, strangely enough, had all the tests done for all the suspected diseases positive. So even the dermatologist who examined him without any test was correct. But he did not suspect two other diseases. So accordingly, the first one, a skin scraping, revealed a fungal infection. The test for fungus came back positive. Accordingly, he was diagnosed with mycosis of the smooth skin of the back. By the way, upon examination, the patient's feet and hands were completely free of rashes. There is no flaking there, so there is no need to take scrapings from the hands. This is because doctors often say that private clinics order too many unnecessary tests. Next, accordingly, the blood test came back positive for syphilis. So those very faint rashes on the abdomen and back, these are syphilitic roseolas, which means secondary syphilis. Indeed, this patient hadn't had any for quite a while, about 6 months, but had been in contact, and it was during this period that secondary syphilis developed. And in addition to this, his immunoglobulin E was around 150, with the normal value being up to 80, which also indicates an allergy. So all three assumptions came together in this patient. And even, as I mentioned, the dermatologist who examined him without any tests was right this time. Well, accordingly, taking into account his financial situation, since the patient is a student, he was naturally referred to a dermatologist, specifically at his place of study, so that, first of all, she could refer him to a dermatological dispensary, and secondly, if necessary, prescribe topical treatment and additional allergy testing if, again, she deems it necessary. Therefore, when dealing with any skin rashes, you need to consider not only allergies, but also various other possibilities. To do this, you need to be a specialist and use not only your trained eye, but also at least the simplest tests, which are widely available. Of course, this is not always readily available for doctors at dermatological dispensaries and so on, where there are certain limitations. However, in general, at least some minimal tests are often necessary to make the correct diagnosis. Therefore, do not rely solely on the doctor's eye, even if he claims that he is completely right and confident about it. Try to ensure that any diagnosis is confirmed by the appropriate test. If you are diagnosed with an allergy, make sure it is confirmed by tests for those specific allergic reactions, some kind of reactions.